Hello, my name is Dr. Jean Connors. I'm a hematologist at Brigham and Women's Hospital and Dana-Farber Cancer Institute. Today on this episode of the Clot Chronicles, I would like to discuss the Caravaggio Trial. The Caravaggio Trial was a study of Apixaban, a direct oral factor Xa inhibitor, versus dalteparin, a low molecular weight heparin, in patients who have cancer. The trial was conducted in multiple countries around the world and enrolled over 1,160 patients. Patients were followed for 6 months and evaluated for recurrent venous thromboembolism events or major bleeding and clinically relevant non-major bleeding as separate endpoints. In this trial, Apixaban was found to be non-inferior for preventing recurrent venous thromboembolism compared to dalteparin. Now, dalteparin had been the gold standard for treating venous thromboembolism in patients with cancer since the publication of the Clot trial in 2003. At that time, the only other anticoagulant available for use in the outpatient setting was warfarin or the injectable low molecular weight heparins. And low molecular weight heparin was found to be better because it's very difficult to manage warfarin in the setting of chemotherapy and the complications that cancer patients have. The Caravaggio trial is important not only because Apixaban was non-inferior or was just as good as dalteparin at preventing recurrent blood clots, but it had a significant finding of no difference in major bleeding compared to dalteparin. Two other recent trials of direct oral anticoagulants, the Hokusai VTE cancer trial and the SELECT-D trial, looked at edoxaban and rivaroxaban in patients with cancer and found that they too were non-inferior to dalteparin for preventing recurrent venous thromboembolism, but they were associated with a significantly higher rate of major bleeding than Apixaban. So Apixaban appears to be safe for all types of patients with cancer in that the rates of major bleeding were not different compared to low molecular weight heparin. Now, in the SELECT-D trial and the Hokusai VTE cancer trial, it seemed that patients with GI tract malignancies were the patients who had bleeding events. Those patients in the Apixaban trial, the Caravaggio trial, did not have an increased rate of bleeding, although this was not a pre-specified analysis. So unless your patient with cancer and venous thromboembolism has concerns for drug-drug interactions or concerns for GI absorption, if they've had resected bowel, resected parts of their stomach, we can pretty much safely use Apixaban in a wide array of patients with cancer. Thank you for your attention to the Clot Chronicles today.